Ligaments of the spleen are gastrosplenic ligament, lienorenal ligament, phrenicocholic ligament and the lienophrenic ligament. Coming to the gastrosplenic ligament, the gastrosplenic ligament mainly extends from the greater curvature of the stomach to the upper border of the hilum of the spleen. The lienorenal ligament extends from the anterior surface of the kidney to the lower border of the hilum of the spleen. All the ligaments of the spleen are made up of two layers of peritoneum. Here the content of gastrosplenic ligament is mainly the short gastric vessels and the left gastroepiploic artery, whereas the lienorenal ligament mainly contains the splenic artery. Phrenicocholic ligament, as the name itself implies, it mainly extends from the left cholic flexure to the left side of inferior surface of the diaphragm. Here it mainly suspends the anterior end of the spleen, hence also known as sustentaculum lenis. Lienophrenic ligament is nothing but the extension of the lienorenal ligament. The upper border of lienorenal ligament extends from upper surface of the spleen and goes and attaches to the under surface of the left side of the diaphragm, hence also known as suspensory ligament of the spleen. Blood supply to the spleen is mainly by the splenic artery, which is one of the branch coming from the celiac trunk. After its origin, it runs all along the upper border of the pancreas and it is tortuous in course and goes and supplies the spleen. Other branches of the splenic artery are short gastric vessels, left gastroepiploic artery and the pancreatic branches. Venous drainage, the 4 to 5 tributaries of the spleen vein will join to form the main vein, which runs along the posterior surface of the pancreas, and at the level of neck of the pancreas the splenic vein joins with the superior mesenteric vein to form the portal vein. Other tributaries of the splenic vein are short gastric vessels and the left gastroepiploic vein and the inferior mesenteric vein. Coming to the nerve supply, the nerve supply is mainly by the sympathetic fibers which are coming from the celiac plexus. They will supply the blood vessels and the smooth muscle fibers which are present in the trabeculae and the capsule of the spleen. Lymphatic drainage, normally the tissue fluid which is formed in the spleen is directly enters the venous sinusoids, but the trabeculae, capsule and the visceral part of the peritoneum of the spleen will be drained by the pancreatico-splenic group of lymph nodes.